What is palliative care, and why might a cancer patient want to know more about it? Palliative care is specialized medical care that focuses on improving the quality of life for people with serious illnesses like cancer. It's not just about managing pain, although that's a big part of it. It's also about addressing other symptoms like fatigue, nausea, difficulty breathing, and other physical, emotional, social, and spiritual issues that can arise when you're facing a serious illness. The goal of palliative care is to improve your quality of life, not just prolong your life. It's about living well and as independently as possible with the time you have left. And it's for everyone who has a life-limiting illness, not just those in the final stages of a disease. You might be dealing with the challenges of a cancer diagnosis and wondering how palliative care can help. Let's talk about it. We'll be discussing 3 ways that palliative care can help you or your loved one through this journey. Firstly, symptom management. One of the main benefits of palliative care is that it can help manage the wide range of symptoms that come along with cancer and its treatment. These symptoms can be physical, emotional, social, or spiritual in nature. Palliative care specialists work with you to develop an individualized plan to address your specific needs. They have the expertise to manage complex symptom clusters, which are groups of symptoms that often occur together and can be challenging to deal with. An example would be fatigue, insomnia, anxiety, and loss of appetite. If these symptoms aren't effectively managed, they can quickly become overwhelming for the patient and their family. But palliative care can also help with the emotional and practical challenges of a cancer diagnosis, such as helping patients and families cope with the psychological impact of the illness, providing counseling and support groups, assisting with advanced care planning, and ensuring a smooth transition between different care settings. Secondly, focus on quality of life. Palliative care places a strong emphasis on improving the quality of life for both the patient and their family members. The specialists involved in palliative care, such as doctors, nurses, social workers, and counselors, work together to develop a holistic plan that takes into account the patient's physical, emotional, social, and spiritual needs. This might involve providing medications to manage pain and other symptoms. But it can also include helping patients and families find resources to help with transportation, financial concerns, or finding in-home support. By taking a proactive approach to symptom management and quality of life, palliative care can help patients stay as independent as possible for as long as possible. Thirdly, collaboration with other treatments. Palliative care isn't a one-size-fits-all approach. In fact, it's highly individualized and adaptable. It's not a single intervention, but rather a comprehensive care plan that evolves as the patient's needs change. What sets palliative care apart is that it doesn't just focus on one aspect of a patient's health, such as their physical symptoms. Instead, it takes a holistic approach that considers the patient's emotional, social, and spiritual well-being as well. And this makes palliative care a valuable addition to any cancer treatment plan, regardless of the stage of the disease. It can be provided alongside chemotherapy, radiation therapy, or other treatments, or it can be the primary focus of care when curative treatments are no longer an option. If you're a cancer patient, it's essential to have a team of healthcare professionals who are dedicated to improving your quality of life. Palliative care specialists are trained to deal with the complex challenges of serious illnesses like cancer. They can help manage your symptoms, provide emotional support, and ensure that you have the resources you need to live as comfortably as possible. So if you're really looking for ways to improve your quality of life and better manage the challenges of cancer, consider reaching out to a palliative care team. With their help, you can focus on living well and make the most of the time you have. That's all for now. See you next time.